Good day, everybody. Welcome to Dental Voice, Season 2 with Zyris. My name is Rolando Mia, and today we have a special guest. Before we get to her, I want to express that Dental Voice is a forum to give our clinicians an opportunity to speak about their perspective, their experiences, things that they're dealing with, and most importantly, get some advice from them based on the things they're doing. Today, we have Laura Murphy, who is a registered dental hygienist, and she also comes to us because she works with someone we love dearly, Dr. Thomas Hirsch. Good afternoon, Laura. How are you?
I'm doing wonderful, Rolando. How are you?
Really well, thanks. Thank you for joining us. Really appreciate the time. If you
Pleasure.
could you give us just a little bit of a background on who you are, how you got here, and kind of the experience that you have?
Absolutely. I've been in dentistry for quite a long time. I started off as a DA, dental assistant, and then became an RDA, registered dental assistant. And I worked in oral surgery as a surgical assistant before going into dental hygiene, which I've been doing now for 20 years. So all my entire career has been almost 30 years long. And so I've got a lot of experience. I've worked in 3 different states and with a lot of different types of doctors. But with COVID, it's kind of turned everything upside down and made everything new again.
Oh, wow. So wait a minute. So you've been a dental assistant, you're
Yes.
CDA, and now you're also what's from an operational perspective, what would you say is the biggest difference between your work as a dental assistant and then you work as a registered dental hygienist?
Well, the main difference is when you're a dental assistant, you're practicing four-handed dentistry, right? Because you're working side by side with your dentist, and they rely on you. You're their right-hand man. You never leave their side. You follow them from room to room, try and keep up with them. And with hygiene, you're on your own, no assistant. Yeah, and you have a lot more freedom, a lot more uh, leeway to make your own schedules, and it's a really rewarding career. And I've loved hygiene, and it's been a nice progression. But I also didn't want to keep going into dentistry because I wanted to not really have that much responsibility outside of the practice, right? I don't want to get those 911 dental emergency calls over the weekend.
So wait a minute. So did you, when you entered into this, did you know you were gonna end up becoming or progress to becoming a dental hygienist, or how
I
did that?
didn't. I got into dentistry when I was 21 years old. I was living in Boston at the time, and I always just loved going to the dentist ever since I was a little girl. I had good oral hygiene. They always gave me high fives, told me I was the best patient, and it just was a happy place for me to be. And so when I went and moved to Boston, I found a dentist because there's a lot of professors in Boston, a lot of professors that work for Boston University, Tufts Dental, that were willing to train me with no experience. So I got in with zero experience. I was cleaning rooms in the beginning, doing sterilization, worked my way into the op and four-handed dentistry, and then decided I liked that. Got my radiology certificate, became a registered dental hygienist once I made my way to California, and then got into surgical assisting with a really amazing oral maxillofacial surgeon here in Beverly Hills. He's a DDS MD. He trained me, also gave me a very good, broad understanding of what happens if you don't take good care of your teeth, or if you have issues
Right.
or accidents and you need to have reconstruction. And so I've seen the whole gamut, and so I really like the prevention aspect of dentistry. I like to be the patient advocate, as you will.
That is cool. That is so cool, and I love the fact that you have not only a perspective but experience
Yes.
across different functions. So you kind of know. You mentioned earlier COVID. Holy cow! Up until this year, your entire career didn't have it, and then all of a sudden, COVID showed up. What would you say are the biggest one, two, three things that it did to what you are currently doing today?
Well, the first thing that it did was completely take me uh, off guard. I went into dentistry because of it's security, right? I thought I'm never going to have to worry about finding a job. And when COVID hit, it was like I ran into a brick wall. Am I ever going to practice again? What's going to happen here? And I was terrified because, I to have to possibly start all over again. Who knows when we're going to reopen practices and if they were going to name us as essential, which they didn't in the beginning in California. So I was unemployed immediately for about 2 months. And I was working at the time in 2 different dental practices, one in Beverly Hills and one Dr. Tom in Malibu. And they both just closed their doors, right? And so it's been, and I understand not just for me as hygienists, as dentists, everyone in the dental field, there were a lot of questions, and I didn't know how they were going to proceed. And some dentists just shut their doors completely. Some hygienists just wrapped up their tools and got out of the profession. And it's been a really wild ride. And because there's not a lot of definitive answers for us, right? Even just the population as a whole. Some states you can eat in restaurants, and some states you can't. So it's really hard to navigate. And then also, when you see that dental hygienists are number one on the professions that are most likely going to be has the most likely chance to become infected with COVID, then that's a whole nother level, because even when you do get back to work, you don't know if you should be back to work, right? So it's been really, really difficult. I'm very lucky that I have a really amazing boss that takes every single precaution to make sure that we feel as safe as possible, because that's not normally that's kind of more on the rare side, as I've come to find out, because I've been had to temp a little bit in the beginning here to pick up some days when hygiene was allowed to start again.
So when you say it's not it's not common or it's not typical, what do you mean by that? Because we've had other guests on, and a lot of them are saying a lot of precautions. What's some of the experience that you've seen with regard to other practices?
Okay, so when California allowed dental hygienists to come back into the practice and start seeing patients, I was, like I said earlier, I was working in 2 offices, one in Beverly Hills and one in Malibu. My Beverly Hills practice did not reopen. My Malibu practice did, but there weren't enough patients yet to fill the days that I wanted to work. So I started temping I had a couple friends that are office managers, and their hygienists had little babies at home and couldn't come in. So she called me. And so I was filling in, helping out friends of friends who have practices. And, the other 3 practices that I worked at, they didn't really have change anything other than the fact that they wouldn't allow me to use a Cavitron or piezoelectric. So I had to hand scale everything. They didn't give me any extra time for patients, and the PPE, and this is not really their fault, because PPE was really scarce. You have to use a mask all week, and you have to use your gown all week. And it's really interesting. And I felt bad for these dentists as well, because they're also struggling, right? Everyone's worried. And but at one of the practices that I was working at, I had an hour. I would get a new patient. I have to take an FMX probe and then do an exam and a cleaning in an hour during COVID, which is just, it just wasn't working for me. And also the pay went down a lot, it seemed like, because I was taking more risk and getting paid less. Basically, I was getting paid what I made right out of hygiene school 20 years ago, in temping in these offices. So it was an eye opener. And it's interesting that the doctors just don't really want to invest right now into any kind of new high-speed evacuation system to protect their hygienists. A lot of them, it seems like. And I understand also that maybe because they're worried about taking on any other new expenses, but they would have it for themselves when they're doing dentistry. But the hygienists, they're like, just hand scale and deal with it, so.
Wow. That dovetails very much so into some of the feedback that we'd received, in that there were hygienists who would express that, or we'd hear stories about hygienists who felt that they weren't getting the kind of support. What's the so just as a contrast? What's the big difference with Dr. Tom's office where you are now? How would you say what's the
I mean, he's the gold standard. There's no holes barred with. He wants to make sure everyone, his patients, staff, everyone is as healthy as possible. So he has shortened our days. We were seeing 8 patients, an hour each patient. He shortened our days to 6 patients a day. We get an hour and 20 minutes, so we have the proper time to turn over our rooms. He also has the isolate, which is phenomenal. As a hygienist, you kind of get into your routine, especially when you've been doing it for 20 years. So first couple of days, I felt like I was a newbie again, but now I don't even think about it. It's amazing. It's really given me a whole another level of security, and the patients really enjoy it too. And they really appreciate the fact that I have that technology to use. And another thing that he has done, he has invested in some hypochlorous acid sprayers. So we are able to fog down our room for 10 minutes between each patient, so that there's no aerosols that are remaining. We also spray our patients down when they come into the operatory before they sit in our chair. Yeah, we spray them down, and they actually get quite a kick out of that. So yeah, the whole process has changed completely. Patients are told not to come up to the office until they call and they are given permission to come up. So there's social distancing. There's not a lot of people in the waiting room. They come in, they go directly to a questionnaire that we ask them about if they traveled, if they've had a COVID test, all these questions that are pertinent to know. And we take their temperatures, of course. We bring them in. We have installed shower curtains on the rooms now, because they used to be open bay. And so just to kind of keep everything a little more compartmentalized. And then, like I said, we do the hypochlorous acid. We have them sit down. We give them hand sanitizer. Then we have them rinse with a peroxide rinse. And then we spray them again before they leave. And they really appreciate it. They really do. And I really appreciate it. The other offices, some offices aren't doing even temperatures that I've noticed. So, or if they do, they're not making a log of it. So you really need to make sure you have a log, you're taking your notes, you're doing everything you possibly can in case there ever was an issue.
Wow, I love the contrast, because I hadn't really heard the other side. And I appreciate that, because there are always two sides to everything. Did you feel fear or apprehension about coming back, given all the craziness that we're hearing out there from everywhere?
Yeah, absolutely. I was very worried because there wasn't a lot of information, and then you're getting all kinds of conflicting information. And if you go on the internet, you're really going to get crazy. Just going to get yourself worked up into a tizzy, But, and it's interesting too, because, here in California, you still can't go in and get a haircut, but you can get your teeth cleaned, right? You can't go to church. You can't eat in a restaurant, but you can go to the dentist. So, and a lot of hygienists were saying, why is that? Why is it that we can go, you can have such an intimate appointment with a dental hygienist, but you can't go get your hair cut or colored, So there's a lot of questions. And there's really not any kind of an answer. It's just kind of we'll see what happens, kind of a mentality. So I understand where the divide that I've been hearing with some dentists and hygienists, the hygienists kind of come off as being a little bit of high maintenance, because they want to make sure that they have the proper PPE. They want to make sure they have the amount of time that they need, and the dentists, that's not their priority, So it's a really interesting time to be in dentistry. It's I never thought I'd see this. I never even imagined it. So it's
That's so. For those, I love the context that you're building, especially based on the experience that you've had in other offices. What advice would you give? Because there are still quite a few clinicians, dental hygienists, dental assistants, who are still struggling a little bit. How did you get past that? What advice would you give them regarding what to do?
Really the only reason why I got past it is because I feel protected. Like when I was working at those other offices temping, I really didn't feel protected at all. Even though I was wearing my face shield, I was wearing my N95, I had my gowns, but you're still without that high-speed evacuation, that isolite. You see the splatter, you see things. You can see it's happening. I can see it on my gown, right? So it's it it just really that's really the only way I got through it. Otherwise you're just kind of hoping that you're gonna, that you're doing what you can and that it's good enough, right? So it's hard though when it's not up to the hygienist to take
Right.
control of her environment. She's at the mercy of her boss, right? So I've read, I'm on all these dental hygiene forums and I see these stories and these problems and some of the things that the dentists are saying and some of the things that their hygienists are saying. And there's a lot of friction in some of these practices. And I'm so blessed that I don't have that in mind. Yeah.
That's so amazing. You mentioned splatter. Well, if when you think about modes of transmission, right? You've got fomites, the hard surfaces.
Mm-hmm.
You've got droplets, and the spray, splatter, spatter, and then you got the aerosols.
Mm-hmm.
Where, based on everything they're throwing out there right now, where are you personally with regard to those three different things? I mean, what are your thoughts on those?
Well, I just try and protect myself as much as possible, and it's, you can't be 100%, and you have to also trust your patients that they're telling you the truth, that they're feeling okay, that they haven't traveled, on a plane train, for the last 2 weeks. And, it's funny because I think I went back to work in April. I finally had my very first patient who had COVID, was hospitalized for 5 days and survived. He was 87 years old. He didn't even know he had it. He went in for his physical and they told him he had it. Kept him in the hospital because of his age for 5 days and he was fine. But that's my very, very first patient since back to work that was hospitalized and healed and good as new again. Was lovely to see, especially
How
at
did
his
you
age.
how did you feel treating your patient?
I wasn't worried at all. He had been out of the hospital for about 4 weeks, and he looked just as fit and fiddle as I remember him before he found out. And I found it was very interesting that he didn't even know he had it. He had no symptoms, So he keeps himself in good shape at 87. So I don't think he had any pre-existing conditions, thank goodness. But
Wow. That's it's amazing because that happened. That is that it's
that's
okay. No, it's fine. We have dogs too, and they like barking at the wind because the wind is scary. I don't know, but
yes.
it's amazing to think that one of our guests, Dr. Resnick, he mentioned what makes it so scary is not only is it potentially airborne because of aerosols. We know about the spray and the splatter, droplets and stuff, but people can be completely asymptomatic.
Exactly.
So you could potentially be treating someone, no temperature, no nothing, but then they have it and you could get it. I mean, does that kind of enter into your mind as you're working with
Yes,
your patient?
that's the big worry, right? That these people can be spreading it and not know it, and so it's just you have to just be diligent. I don't like the fact that dentists are still pushing these really rigid schedules and piling on like nothing happened. I feel they really should allow their hygienists to have a little more time to at least 10 minutes to like have the room settle down and everything. In the hypochlorous acid, I think is a brilliant idea. I think everyone should be using that in schools, dental clinics, hospitals. I mean, that gives me another level of protection too. Is anything that may escape, then it's just another level, just another little precaution that I feel is pretty important.
What is your current experience with all the PPE that you're having to put on and the mask?
My mask looks like a fishbowl and it wraps underneath, literally. So I'm talking to people and it sounds like I'm yelling at them and they can't hear me, and it's silly. And then I have my light and my loops underneath that. And then, N95 with another mask on top of that, then a paper disposable gown, and then a paper shower cap on my head. It's, I mean, I could be anybody. You don't know who I am under all that. It's like these people have no idea. They don't know what I look like if they're a new patient. It's kind of weird, that one day they'll see me and I'll be like, oh, that's what's under there under all that. I've actually seen that some offices are starting to put pictures of their staff with their PPE and then without on their website, so patients can actually see what people look like.
How are you navigating? Is it causing you to have to change the way you're doing your operative work, the way you're engaging, all that type of stuff?
Not really. I mentioned earlier that I was in oral surgery, so I was used to scrubbing up and going into the OR and doing Leforts and, maxillofacial surgery, which was really fun and exciting. But so it really was easy for me to make that transition because I had done that type of even more so with being sterile. But yeah, a lot of the other girls I work with, it gets hot under there. That's the main thing. When you feel like sweat dripping and, and we tell our patients, we're keeping the ops cold. We don't have blankets to give you anymore. We don't have pillows to give you. If you need a pillow for your neck, you need a blanket for your lap, you need to bring your own, dress warm. So that way we can really drop the temperature and work as comfortably as possible. And people listen and they bring their little blankets and everyone's fine.
Oh, it's so cool. From a patient perspective, what's the experience you're having with them as they come into the practice?
It's interesting. It's all over the place. Some people don't care at all. They're like, whatever, you don't need to do all this, right? They don't. And then some people are like, what are you doing? What is that? And then of course, then you have the people that don't want the hypochlorous acid because they think it's possibly toxic when we have to explain that to them. It's all over the place with patients, and some of them still haven't come back. We call them and they're like, nope, we're going to wait, so it's, and then we have some that couldn't wait to get in because they had nothing on their calendar at all but a dental appointment. So they were like, I finally have something to do, so those are the patients I love because they're so excited to see me. They're like, I'm out of the house, It's nice. But overall, it's been great. People are very appreciative. They thank me for doing this for them, and they're grateful. And it's been stressful but rewarding at the same time.
Wow. Wow, that's so cool. And I could see the gamut of those, and the ones who are like, yay, I'm out.
Yes.
Oh my goodness. Purely from a looking forward perspective, COVID is going to be with us, like hepatitis is, like HIV is, like any of the other things. How do you see this affecting not just what you're doing, but dentistry overall, and how we're operating in this industry?
I think that this is going to be the new norm. I really do. I feel like I don't see us going back, because who knows when the next pandemic virus is going to come around, God forbid. But I think that they haven't made any standards. The American Dental Association hasn't really made any specific standards, but I hear they're working on them, and I do believe that there's things are going to be held to a more strict standard. I think I read someplace that if you're building a new practice, there's a lot of new things, new regulations like air purification and lighting, things like that they're going to mandate that you put into your practice when you build them. I don't know if that's true, but that's what I was reading in some states. And it's also interesting because we can't have any dental reps come into the office, so that's another thing, right? So you don't get to see your Patterson people or your whoever you get your supplies from, and people that you're used to seeing. It's they're not really able to come in and drop in and say hello to you at this point.
See, and actually that's an interesting thing, because what I've learned is a lot of the clinicians, either dental assistants, hygienists, are also working at other places. I noticed you have, was that Burst back there?
Yes.
That's something that you do too, right?
Yeah, it's an oral care company based out of California. They're based in Venice Beach, California. And I've been with them for about 3 years, and they're an amazing oral care company that you can become an ambassador to this company, but you have to have a dental professional license to do so. You have to be a DA, an RDA, RDH, or RDDS, right, to work with them. And they're really growing. They just got funding, so they're going to go worldwide pretty soon. So I started off just as an ambassador for them, and now I've moved up into an office specialist. So right before COVID hit, I was going to be doing lunch and learns, right, going in and just explaining the product line, and so that put a damper on that because I can no longer do that. But they're innovative, so what I am able to do is just a little more inconvenient. Is I'm able to do a Zoom lunch and learn while I'll have the food delivered. And then, I'll have a little slideshow on Zoom that I can, just show them. And it's interesting though, because some offices have computers without the capacity to have a microphone or a camera. So sometimes I can see them, but they can't, they can see me, but I can't see them.
Right.
And then I'll have to call them on my phone and put it on speaker to talk to them. It's crazy, but it works, and I love it. I am hoping that sooner than later I'll actually be able to get out and start going out and meeting people and visiting them in their actual practices.
I believe at some point we'll be back in there, but it's going to be a little while. Yeah. It's interesting. You said you have to get innovative in the way you engage. Are you doing like Zoom stuff with your patients too, or is it mostly?
I have not done the Zoom, particularly with patients, just usually over the phone. I know Dr. Hirsch does some consultations via Zoom, and so did my practice in Beverly Hills. But particularly myself, I have not done that yet.
Like teledentistry, having them FaceTime them.
That's growing pretty rapidly, actually, that teledentistry, and so is telehealth in medical as well.
That is so. The link for systemic health to oral health is now becoming, I mean, it's always been there, but with the advent of COVID and the fact that people haven't come in, it's now becoming even more important for especially the recognition that your mouth is tied very much to your body. When you're educating your patients, when you're educating folks about it, what is the message that you get out to them with regard to kind of this link?
The evidence is just mounting every day on the implications of the mouth-body connection and systemic links with periodontal disease. They believe that chronic inflammation is the light switch that can turn on all other types of autoimmune disorders and things of that nature. So I'm always stressing that with my patients, that if your gums are bleeding, that's chronic inflammation, and you want to get that under control. And basically the mouth, if the eyes are the window to the soul, the mouth is the window to the body. That's how I like to tell my patients. And just a few months ago, they had proven that periodontal disease is a contributing factor, an actual cause, such causation to Alzheimer's. So that's pretty intense. They found oral bacteria in the brains of Alzheimer's patients, and then they were able to, with the DNA, actually prove that's one of the causations. So that's one of the things I like about this company, Burst. One of the ways they innovated is that it's a subscription service. So when everyone was scared to go to the store, or there were things that were running out at the stores, they were able to ship directly to the patients. And I was stressing that to my patients, like, make sure you're changing your brush heads more often, okay? Just to be safe. And because flu season's coming up as well, I'm also still recommending that. And just making sure that they're flossing, and their oral hygiene at home was really important during all of this, since we didn't know when we were going to open, and just so everyone maintained themselves as best as possible.
Cool. Are you seeing patients with issues because they haven't been to the dentist in a while?
Yeah, well, Dr. Tom, he didn't close at all because there were so many dental emergencies, a lot of infection, a lot of root canals, a lot of pain, a lot of swelling, and a lot of dentists that weren't offering that service as well. So people who had emergencies couldn't go to their regular dentist, and they were, kind of just had to find someone really quickly. And it really was limited. A lot of doctors just didn't want to be working at all, and so the patients were really put in a bad position when they were having a dental emergency, a true dental emergency. So, and then of course, yes, my patients that are seeing me every 2 to 3 months, I have a lot of those. Yeah, I have some catching up to do when they come in. But
So,
it's not their fault. Everyone's overdue, and a little more plaque and calculus accumulation because of it.
so if you were to take everything here, and for our viewers, clinicians, patients will see this and all that type of stuff. What's the message that you'd like to give them with regard to going forward and kind of their relationship with dentistry and you?
Well, I would just recommend people to really take a deep breath, take the time, not to rush. Make sure that if you have an issue, that you address it with your doctor, and in a very non-confrontational way. Because you don't want to have a riff between you and your boss, but you want them to be able to understand where you're coming from. And now that the PPE is easier to get a hold of, that problem's kind of evened itself out. That's really good, that you don't have to wear the same mask and the same gown. It's so that's made it a lot less stressful as well. But mainly just if one of the best things I say is definitely try and get some type of a isolate system in your office. I know it might, that's really because, like I said earlier, the patients are overdue. They have a lot more plaque and inflammation, than normal. And then if you're having a hand scale, it's just it's not easy, And it's nice being able to use my Cavitron and feel comfortable with that. I feel protected, and the patients are still getting the great standard of care that they got before COVID.
Cool. Thank you for that. Really appreciate it. If people had questions for you or they wanted to contact you about anything, the things that you're doing or hygiene or even the stuff at birth, what would be the best way to get in touch with you?
Okay, well, they can email me directly. If my email is Murphys, MURPHYS, and the number 3. So Murphys3@me.com. And then I also have a Facebook and an Instagram account. It's at Healthy Kisser. So you can also find me on Facebook or Instagram under that. And feel free to direct message me if you have any questions about how I feel with the iSlide, any questions about using iSlide, if you have any questions about first oral care, any questions at all, I'm more than welcome to answer them.
That is awesome. First of all, thank you so much for taking the time. Thank you for being so direct, just so candid about what's going on. And I'm happy to hear that things are working out and that, that it's going good. I love the stories about your patients and the different types. I think that's kind of neat. And yeah, hey, folks, if you have questions, please reach out to Laura. She's been doing this for a while, and her sentiment, message, and the experience she has is huge. If you like this content, please go ahead and share it. If you have questions for us, please forward them to them. Laura, thank you so much for taking the time. Very much appreciated, and it's an absolute pleasure. I really appreciate that. And if at some point here in the future, several months from now, when we're further down, would you be willing to join us again and then kind of update on how things are going?
Absolutely. I would love it. And I really appreciate you having me on today. It was really fun.
Awesome. Well, thank you so much. Hey, everybody, have a great, wonderful week. Please be safe, and we'll talk to you soon. Thank you, Laura.
Oh, you're welcome.